Hello, my name is Linda Santiago. I wanted to speak about pulmonary hypertension. What pulmonary hypertension is a rare disease which eventually kills you because it's progressive. What it does is it makes the pressures of the lungs go up, which means that the arteries of the heart shrink. Therefore, there's no flow to it, which means there's no blood and oxygen going to your heart, which makes your heart, the right side of your heart, enlarge and eventually causes heart failure, and that's how people eventually die. Pulmonary hypertension is actually not curable. There's no cure to it. There's about 14 treatments out there for it, which what they do is slow down the progression of the disease. And there are actually three different categories. There's pills, which help in alongside of infusion pumps, which the infusion pump is on you 24/7, and it actually has medicine flowing directly to your heart arteries and your lungs. And then we have the inhalable ones. Okay, I'm sorry about that. They actually, you gotta inhale them probably every 2 hours. It's a set schedule for it. Most people don't like going with that. They usually go with a combination of pills and the infusion pump because it actually is better. You get better results with it, and your progression kind of does slow down. Whenever the progression don't stop slowing down, it actually keeps going and it gets worse and worse, that's when the doctors start looking into a double lung transplant or a heart/double lungs transplant to be able to actually make your lifespan a little longer so that you don't die from pulmonary hypertension, which can happen if you don't catch it on time. Also, living with pulmonary hypertension can be life-changing, I would say. I'm actually a victim of pulmonary hypertension. It has given me a 360-degree change. I wouldn't say for the bad, I will say for the best, because it has taught me a lot in life now. The past 4 years, I have learned to actually appreciate things that I didn't before, and now I actually do. I appreciate every day I get up and open my eyes, and I also appreciate the fact that I can walk and do things normally like a normal person, and I don't feel sick thanks to having the pump, infusion, and pills that I have for treatment, which help me live a normal life. Also, when you have pulmonary hypertension, you must not consume no sodium because sodium would eventually lead to heart failure. So you don't want to have a lot of salty stuff or junk food or anything like that. You want to exercise regularly, lightly. Don't kill yourself, but you do need to exercise so that your heart gets stronger. Also, whenever I was diagnosed, I had issues getting Medicaid here in Florida. Having Medicaid, you have to be like 65 years old or you have to be pregnant. It doesn't matter if you have a chronic disease like I do or if it's killing you or anything. They really don't care about that. They care about you being 65 and older or pregnant. That's the only way you can get it. So the first 2 years, I didn't have no type of insurance. The only financial assistance I had was the one from my own drugs that I actually got prescribed. The actual company will help pay for the full amount of the drug, which they can be very pricey. Just one bottle of Remodulin, which is one of the treatments, the main treatments of pulmonary hypertension, can cost you up to $13,000 per bottle. Most people need 2 a month. Right now, I actually need 8 a month. So you make the math. It's a lot of money. And also you need a right heart cath every year. The heart right cath, what they do it for is to check the progression of your disease. if it's better, if it's worse, if the drugs are good for you, are doing the right work, or do we have to change, things like that. So what I did when I was actually still in the hospital when I was diagnosed was apply for disability. Thank God immediately I was approved for it. So during those two years waiting period, I waited and they gave me Medicare. So now Medicare helps for my financial needs and the hospital stays and procedures I might need, the drugs I need. And also some people actually get private insurance, but having pulmonary hypertension can disable you 100%. So it can be hard for you to get a job, especially depending how bad is your progression already. Do you even sometimes there's times that a patient may feel like they really don't want to get up the bed, and that happens with us a lot. So it's kind of hard working having this condition, but it's not impossible. You can do what you can. Having a support system it's been very great because it helps you get through your days, and it can kind of motivates you to keep going and not thinking that one day near you're gonna die or anything like that. And you get to help them too as well. We have a group support which we all get together and we go to a fun spot, or we'll go to a restaurant, anywhere, and we'll talk about our issues and what's been bothering us, and we'll give each other's tips, and we'll exchange numbers so that we can text each other and kind of keep the spirits up and stuff like that. Also, it has given an impact in the healthcare because they're really eager to like find a cure of this rare disease, and they also been wanting to resolve all these ethical issues that we have going on because they just can't explain where the rare disease came from. They want to try to find out all of that and why we're using certain drugs and how to make it better for us as well. In conclusion, I think that having pulmonary hypertension has been actually very positive in my life. It has made me better, and I have learned to help other people and care about other people. And the ethical issues on pulmonary hypertension, we have to actually bring pulmonary hypertension, like awareness to it, so that those ethical issues can go away eventually. Hope you like my presentation, and thank you.